This short presentation will provide information on changes to legislation related to the modification of scope, LPN and RN administration and provision of naloxone. I'm Karen Archibald, professional practice consultant with the College of Licensed Practical Nurses, and I'm here with Lynn Miller, policy consultant with the College of Registered Nurses.
Naloxone is a medication that blocks or reverses the effects of opioids and is used to treat overdose in an emergency situation. It has no negative effects if given to an individual who has not taken opioids.
The Licensed Practical Nurses Act and the Registered Nurses Act define scope of practice similarly to mean the roles, functions, and accountabilities which LPNs and RNs are educated and authorized to perform. Client assessment and administration of medication is within the legislated scope of practice for both LPNs and RNs. Scope of practice is further defined by standards of practice and competencies developed specifically for LPNs and RNs and can be found on the college websites.
In the past, LPNs and RNs required a prescription, an order, or a care directive to administer or provide naloxone for opioid overdose management. Effective January 16, 2018, the Licensed Practical Nurses Act and the Registered Nurses Act have been amended to authorize LPNs and RNs to administer naloxone as a life-saving measure under their own authority and to provide take-home naloxone kits under their own authority.
On my own authority means you can autonomously or independently administer naloxone or provide a take-home kit to clients based on your own client assessment. You will no longer require a prescription, order, or care director. However, you must follow your employer policies as this only applies in the workplace. Currently, there are no other prescription medications that LPNs or RNs can administer without an order.
In order to meet your standards of practice, you must possess the knowledge, skill, and ability, or competence, to recognize potential overdose situations when autonomously or independently providing naloxone as a life-saving measure. In addition, you must possess the competence to assess and determine when an at-risk client would benefit from receiving take-home naloxone and be able to educate clients and their significant others regarding the appropriate use of naloxone. Be sure to use employer policy to support your practice.
Administration or provision of naloxone is currently within the LPN and RN scopes of practice, and most nurses already possess the competence to do this. However, with the legislation change, you now possess the authority to provide this medication based on your own assessment of the client. You should work with your employer if you feel you need additional education or support in recognizing an overdose situation or administering naloxone. There are several online resources available that may be helpful. Please check the College of Licensed Practical Nurses or College of Registered Nurses website for these resources.
Employers should develop and implement policies and processes to support LPNs and RNs to provide naloxone for either indication under their own authority. As a nurse, you're also accountable to advocate for development of these policies and follow them when providing naloxone.
Thank you for listening to this short presentation. If you have further questions, please email College of Licensed Practical Nurses or College of Registered Nurses for further information. Thank you.